Hi, this is Daria Shabbat with CorporateProfile.com. I'm here today with Dr. William Prather, Senior Vice President of Corporate Development of Pluristem, one of the leading cell therapy companies. Hi, Dr. Prather. How are you?
I'm fine, thank you.
Dr. Prather, you have experience in pharmacy, medicine, and stem cell research. Tell our audience what kind of diseases could we potentially treat with stem cell therapy?
Great question. The cells that we manufacture, we manufacture our cells that come from the placenta, which is the afterbirth. And these, by definition, are called adult stem cells. That's in contrast to embryonic cells. Embryonic stem cells are the controversial cells because they entail destroying the embryo, and that's the controversy. And as it turns out, embryonic stem cells are, because of the way they, their mechanism of action, their indications are different than adult stem cells, which is our cells. If you're talking about using cells that are embryonic cells, then those cells probably do differentiate into other tissues, so they have the ability of potentially growing into a different organ. Having said that, the regulatory pathway for embryonic stem cells is extremely long and problematic. And so over the near term, I think you'll see indications from adult stem cells being coming quicker than from embryonic. And the adult stem cells, they don't work by differentiating. They work by, let's call it, immune modulating. The common denominator for our cells is tissue that's inflamed that needs blood. So let's say you have an inflamed tissue and we inject our cells into your inflamed tissue. Your inflamed tissue will then send signals to our cells, and our cells will then secrete an appropriate amount, a cocktail, if you will, of therapeutic proteins that causes you to heal yourself. And then they go away. So they don't differentiate into other tissues. And I think you'll see indications, inflammatory indications, as the first indications for these cells. Things such, for example, as heart disease or peripheral vascular disease or inflammatory bowel disease, but the kind of the sweet spot is the inflamed tissue that needs blood.
Dr. Prather, what is your opinion on medical tourism, and what would you recommend to prospective patients who are looking for alternative treatments that involve stem cell research? Well,
as probably in lots of other things, there are reputable companies like ourselves, and then there are companies that, for lack of a better term, are out to rob people of their money, especially those patients that are afflicted with chronic degenerative disorders like multiple sclerosis or Parkinson's or ALS, for example, Lou Gehrig's disease. There are no clinical indications at this time. There is no approved therapy for those kinds of clinical indications at this point. And certainly there are companies conducting clinical trials. But for those trials, patients that are eligible for enrollment get those cells for free. So there's really no reason to purchase them. So I would recommend to patients that they, red flags be raised if you go to a website or if you encounter a situation where there is an encouragement for you to purchase or buy cells, maybe an offshore clinic or something, for those kinds of disorders. In addition, there is a society that reputable companies belong to, and it's called the International Society for Cellular Therapy, or the ISCT. And patients can go to their website, and there's actually a white paper that's available on their website that will help as a guide to patients in terms of where they should be seeking stem cell therapy and details about that.
Thank you again for speaking to us, Dr. Prather.
You're welcome.
Again, this was Daria Shabbat with CorporateProfile.com. I just spoke to Dr. William Prather, Senior Vice President of Corporate Development at Pluristem Therapeutics. Thank you for watching, and please tune in again for more interesting interviews and hot financial news.